So today's Pain Made Easy course kind of represents the current state of my own professional development in clinical practice, coupled with my desire to share experiences so that others can learn from my errors and epiphanies. So this course is a very clinically derived, patient-focused strategy for guiding and contributing toward, what I call a mindset reset for those who are stuck in a recovery rut, maybe no longer progressing, possibly experiencing sensitization of the nervous system, and generally in need of a change of perspective to allow their recovery. So our end game is to promote client involvement through purposeful action in independence of functional living, and to give back control of their body to the client where it belongs. In many respects, this is nothing new. Many other courses aim to do the exact same thing, and you might ask yourself, so what's the difference? The difference is really kind of, from my perspective, in how the message is conveyed, how we choose to deliver the message, and in what style we deliver it. I feel that too often in medicine, we hear things like, never underestimate a client's ability to receive education in physiology, in medicine, in therapy, and et cetera. And although I agree with that, the mistake is sometimes made where we think that we can speak freely with complex scientific terms as desired. So again, I want my lessons, as the name implies, to be a lot more simple. So I think that if we can bridge that gap between our clients' needs and the role of therapy, or at least the research practice component, research to practice component, and our presentation of concepts is simplified, then we can relate accurate concepts to the client based on their familiarity, not on the basis of our own academic history. So to you guys, the course participants, I also pledge to keep things simple for now and to lead you through the process of understanding your client by teaching from the perspective of your client. I'm not going to teach from the perspective of kind of like a medical research institution, even though I truly love and value them so much. I'm a geek like all of us. My favorite place in Europe was actually Oxford. I was absolutely enthralled by that place. However, my client's favorite place might be completely different. Once I hear from them, I choose kind of my book of terms, and I constantly endeavor to use analogies meant specifically for the client. So I'll share much of this with you so that you too can kind of make pain an easier concept. So the course material is for the client. The focus is on the client's needs, maybe their fears, their desires, certainly their language experiences, and of course their goals. That's the clinically derived part. I've spent a great deal of time organizing these clinically successful education worksheets into a format that's also meant for you, the therapist or program coordinator. The format is essentially a linear progression through 10 sheets that reminds you what kind of path and provides you a reference that you can teach from. In speaking with clients about pain programs that they have attended, I hear oftentimes a common theme. Firstly, that much of the world of pain is seen as kind of master and PhD level information that we often try to relay to common people without using a common language. Pain Made Easy is, in this analogy, grade school level content for pain and function. So secondly, I hear that very interesting information is presented with correspondingly interesting exercises, but for various reasons, the content falls short at times of its goal to influence and guide clients to improving their own function. So I firmly believe that much of this is due to the content being presented too complexly, or maybe too vaguely, or sometimes just too medically. So for clients that feel this way, I've created this simple strategy based on guiding the client through creating solutions specific to their functional goals in a way that makes sense to them. The goals for this course, there's two sets of goals. For the therapy or client management team, what I want to do is provide an easy to follow framework for teaching basic physiology that explains healing and our body's warning systems, for organizing client symptoms in simple hierarchies, for identifying aggravating factors and useful treatment skills, for explaining return to activity in a positive and achievable way, and for providing ongoing client-specific flare strategies. Implementing this strategy into practice is facilitated by providing you guys with a set of 10 client education and communication sheets, a corresponding set of bulleted instructions, which you will receive later for providing that education in the clinic, a printable PDF for a pain rating scale that you guys are hopefully familiar with, because we also gave you access to an explanatory video, and access to ongoing information via communication on Instagram and Facebook, and then mentorship that will grow out of this on the Pain Made Easy platform. The Pain Made Easy course focuses on supplying the tools so that you can provide the client or the at-home family or support structure with easy to follow education and self-treatment strategies that will deliver that basic relatable education, communicating from a safe and familiar place to the client. A strategy that will demystify seemingly unrelated or unexplainable symptoms and aggravating factors, and a strategy that will introduce clients, or maybe sometimes reintroduce clients' understanding and control of their own body. It aims to instill hope in the future, which is big, maximizes the positive power of self-strategy. I call those skills. And the strategy will minimize the negative impacts of symptoms with the idea of a concrete plan, a set of developed skills, and a framework to follow. It will also provide the basic plan to move forward in living life with symptom challenges. Finally, the framework also promotes self-efficacy, leading to complete autonomy. And it provides this mindset reset regarding stress, pain, symptoms, progress, and also healing. So which clients would we say are appropriate for this system or set of sheets? Well, really kind of any client can benefit from individual sheets. That's actually where this started. This started with me just creating individual sheets that were solving problems. And then it kind of morphed and eventually came into this program, which seems to be really good for persistent clients. But any one of these sheets can be used individually with any client out there. As we go through some, you'll see why this might be, but it's not just a plan that has to have 10 sheets. The persistent client, it can be used, and I use it every day, as a standalone program. I do about 30% of my caseload with this program. And then for people that are within or running a multidisciplinary program, this sort of a framework can really act as a kind of a concrete skeletal template for getting clients to return to function and allowing the therapy team to have a good base of communication so that the lessons that they're all giving are adding equally to the program. You'll see in sheet 10, which is a flare plan, there is a place in that for any one of the team members to add important items to the client's flare plan. So by the end of the 2-section course, you'll have all the tools necessary to deliver the simple kind of client-centered plan effectively. You'll be yet another step closer in your professional development goals for stubborn and persistent clients, and you'll have the tools to become more calm, maybe less frightened by our complex clients who are not responding, air quotes, correctly to our typical MSK models of recovery. And of course, your regular clients will all benefit too.